Hello, my name is Lee Soo-yeol and I'm Jeju National University student at the College of Veterinary Medicine. Today I'm going to talk about my report project and the title is Orchiectomy has therapeutic benefits on contralateral testicular injury after testicular torsion. Orchiectomy means extracting testes. Let's begin. Testicular torsion is very common emergency disease among infant or young men. Testicular torsion occurs when spermatic cord gets twisted for some odd reason, and this can damage not only the twisted testis, but also the contralateral testis, which can lead to sterility. When the spermatic cord gets twisted, the blood flow to testis is blocked and this leads to testicular ischemia. If testicular torsion occurs, it has to be restored within 4 to 6 hours. When testicular torsion occurs, that testis will surely be damaged and it has been thought that the contralateral testis will not be affected. However, the increase of FSH or the result of sperm test indicates that testicular torsion damages the contralateral testis too. The mechanism of damaging contralateral testis is not found yet, but there are many theories such as autoimmunity mechanism or decrease of blood flow of contralateral testis. When the blood flow decreases, hypoxia occurs and lactic acid or H2O2 increases. When reperfusion by the torsion begins at this situation, reactive oxygen species, so-called ROS, causes severe damage. ROS binds to the lipids of mitochondrial membranes to produce lipid peroxidases, and peroxidation of these membranes result in cellular damage. Therefore, the torsion of testis damages the contralateral testis indirectly. So I wondered if extracting the twisted testis rather than untwisting it can prevent the damage of contralateral testis, and I decided to study about it. The purpose of this study is to investigate if orchiectomy has therapeutic benefits on contralateral testicular injury compared to reperfusion. First, the test animal is 7 weeks of age SD white male rats. I used 28 rats on this project and they were divided into 3 groups, which are control group, the torsion group, and orchiectomy group. There are 4 rats in control group and 12 rats in each torsion group and orchiectomy group. Then I induced intended testicular torsion. These are the steps to induce testicular torsion. First, I anesthetized rats by using Zoletil 50. Then I incised scrotum of the rats and twisted spermatic cord 720 degrees counterclockwise, which causes testicular torsion. Next, I fixated the testis to scrotal wall and sutured the scrotum. Lastly, for the torsion group, I untwisted the testes of 4 rats after 1 hour, and another 4 rats after 4 hours, and last 4 rats after 24 hours. And for orchiectomy group, I extracted the testes by the same way as the torsion group. For microscopic observation, I collected the tissue of every rat's contralateral testis by these steps. All data were processed by SPSS. These are the parameters of testicular damage I measured. First, to measure the diameter of seminiferous tubule, I choose 10 tubules that is close to circle from centipulp view. Then I measured the diameters of each tubule by using micrometer and calculated mean value. Second, I measured the Johansen score of 10 chosen tubule based on the criteria and calculated the mean value. I will show the criteria of measuring Johansen score at slide 12. Lastly, I counted the number of spermatids per a tubule of 10 chosen tubule myself. Then I calculated the mean value. Now let's see the results of this research. This table 1 shows the value of the diameter of seminiferous tubule. All values are the mean value plus or minus standard deviation. It's difficult to compare each group by just looking at this table, so let's see the graph in next slide. Let's see graph 1. We can see that the diameter of seminiferous tubule of contralateral testis tends to reduce as the testicular torsion time gets longer. Also, the diameter of orchiectomy group is significantly larger than the torsion group in 1-hour torsion and 4-hour torsion. This is the criteria of measuring Johansen score. It goes from 10 points from 1 point as the damage increases. This table 2 shows the mean value of Johansen score plus or minus standard deviation. I made the graph based on table 2. We can see that the Johansen score of both groups tend to reduce as the testicular torsion time gets longer. There isn't a significant difference between both groups in 4 hours and 24 hours of testicular torsion. This table shows the result of the number of spermatids per a tubule. This graph is made based on table 3. The number of spermatids tend to reduce in both groups as the testicular torsion time gets longer. Also, the number of spermatids of the torsion group tend to reduce significantly in 1 hour of testicular torsion. This is the picture of H&E stained seminiferous tubules of each group. A, B, C pictures are the testes of 1 hour, 4 hours, 24 hours detorsion group. D, E, F pictures are the testes of 1 hour, 4 hours, 24 hours orchiectomy group. Let's compare picture A and D. We can see that the tubule of picture A has been shrunk, but tubule of picture D seems quite normal. Comparing picture B and E, tubule of picture B shows more decreased number of spermatids than picture E. Lastly, tubule of picture C and E shows severe damage of testis by shrunk tubule and loss of spermatids. Testicular torsion occurs by twisted spermatic cord, and this leads to testicular ischemia, which is very emergent disease. Testicular torsion thus damages the contralateral testis, and it can cause sterility, so it is very important to know the clinical way to deal with it. So let's see what we can learn from this research. From the result of diameter of tubule, we can see that the diameter of seminiferous tubule of contralateral testis tends to reduce as the testicular torsion time gets longer. Also, the diameter of orchiectomy group is significantly larger than the torsion group in 1 hour torsion and 4 hour torsion, but there wasn't significant difference in both groups in 24-hour torsion. Then, let's talk about the result of Johansen score. We can see that Johansen score of both groups tend to reduce as the testicular torsion time gets longer. Also, Johansen score of orchiectomy group tend to decrease slightly compared to the torsion group. There wasn't significant difference in 4 hour and 24 hours of testicular torsion. Lastly, let's talk about the result of the number of spermatids. We can see that the number of spermatids tends to reduce in both groups as the testicular torsion time gets longer. The number of spermatids of the torsion group tend to reduce significantly in 1 hour of testicular torsion. Also, there is significant difference of the number of spermatids between two groups in 1 hour torsion. There are more spermatids in orchiectomy group than the torsion group. From this research, we can conclude that first, torsion of testis causes damage to contralateral testis, and the longer the testicular torsion maintains, the more the damage occurs. Second, extracting the twisted testis within 4 hours of testicular torsion is more effective way to reduce the damage of contralateral testes. Third, after about 24 hours of testicular torsion, orchiectomy isn't that effective way to reduce the damage of contralateral testes. These are the references. Thank you for watching my research project.